Hello everyone, this is Eric Hong, Executive Director of the Momiji Healthcare Society, speaking to you again about COVID-19 situation as it relates to Momiji Healthcare Society and Momiji Seniors residents. By now, everybody is aware that COVID-19 coronavirus is a pandemic disease that is wreaking havoc all over the world, causing large numbers of deaths, people becoming sick, businesses and services having to shut down, and daily lives interrupted as governments impose restrictions on social, economic, and other activities. The latest data available shows that there are almost 39,000 cases of COVID-19 infection across Canada. Over 12,000 of them are in Ontario, and just under 3,900 are in the city of Toronto alone. More alarming to those of us involved in providing care to older adults is the fact that there has been 660 COVID-19 related deaths in Ontario. Of these, almost half are 60 years of age or older. That means more than 300 seniors have died from this disease or related complications in Ontario alone. On the other hand, the Ontario government is now cautiously optimistic that the situation in this province may be turning a corner and that things might start improving in the near future. However, there is as yet no vaccine discovered to prevent COVID-19 infection, nor is there any effective treatment for it. The only thing that has been found to be helpful in reducing the spread of COVID-19 is physical or social distancing between people. Essentially, that means changing the way people socialize and keeping them apart from each other to minimize the chance of anyone having the virus in them passing it on to the next person. Social distancing is seemingly working. After 6 weeks of emergency government regulations to enforce social distancing, the number of new COVID-19 infection cases found each day is still high, but the rate of increase has apparently slowed down. To limit close contacts between people, public health measures introduced through government regulations have included disallowing large public events like concerts, parades, and other performances from taking place. It includes closing of public recreational spaces like children's playgrounds, closing of non-essential businesses, asking people to avoid traveling if at all possible, arranging essential services workers to work from home if feasible, urging people to avoid crowded places, including food stores, wherever possible, and disallowing gathering in public of 5 or more unrelated people. It also includes requiring persons not of the same household to keep 6 feet apart when they're in public. And also, we are urging older people to not venture out of their homes. Government directives have also made it necessary for Momiji to adapt how we operate to protect the health and well-being of our tenants. That is why we suspended our normal group programs and education classes, and that we replaced our dining in Zero Sun restaurant meal program with delivery of meals to tenants' apartments. We are urging families of tenants to not visit if possible, and if they must visit, to keep their visits to a minimum, preferably to once a week, and to wear a face mask while they are in Momiji, and not to go from one apartment to another. We are also screening all visitors and asking those with presumptive symptoms of COVID-19 not to enter. We have introduced friendly visiting by phone to tenants and other virtual support services. Recently, non-tenants shopping at the Momiji store have taken to socializing while here and ignored social distancing requirements. Unfortunately, then, we have now, with immediate effect, are asking visitors other than tenants of our residents to not visit Momiji in order to shop at the store. We are concerned about our tenants becoming deconditioned and isolated. Alternative programs that allow for social distancing are being developed and will be offered to you soon. There is hope that the spread of COVID-19 might be leveling off in Ontario. Reduction in risk of infection might come soon. But until then, Momiji as a community made up of clients, tenants, and their families, volunteers, and staff must continue to be vigilant and collaborate to keep everybody both safe from COVID-19 and well. As always, your comments and questions are welcome. I will do my best to respond to them as soon as and as best I can, so please send them on to me. My email address at Momiji is ehong, E-H-O-N-G, @momiji.on.ca. Thank you.